All right, the NSSM 200 is a report for depopulation. It says implications of worldwide population growth for U.S. security and overseas interests. The 1974 National Security Study Memorandum. And somebody did me a big favor by putting this in a book format that I can just flip through. Makes it a little bit easier. This is now in the public domain. It was classified. It has since been declassified. Put together in 1974, just following the UN's World Population Plan. Documents like these, it's necessary to read between the lines. They'll say a lot of things like family planning. Well, that just means abortion, is what they're talking about there. Note the focus on appearing benevolent to the public as we go through here so many times. And to me, I think they're defeating the purpose. They make a point of saying we need to be really careful about how we present this to people because we don't want to look like psychopath criminals. So they know that that's what they are, and they're trying to prevent having that appearance. All right, now I marked out a few things to take note of in here. I'm not going to go through all of it, obviously. It's about 120 pages long. LDCs themselves must play the most important role to achieve success. So what is their rationale there? Their appearance is, again, a benevolent appearance. We need to help these lesser developed countries. That's not it. It's that LDCs reproduce too much. There's too many people, and we need to stop that from happening. Family planning information and materials based on present technology should be made fully available as rapidly as possible to the 85% of the populations in key LDCs not now reached, essentially rural poor who have the highest fertility. So there it is. There's their motivation. We got to control the rural poor. Support by all federal agencies for biomedical research in this field should be increased by $60 million annually. This was back in 1974 when that was even more money than it is now, and it's a lot now. And they're saying increased by that number annually. Not just you get 60 million annually, but 60 million more than you did the previous year. They invest a lot of money into depopulation. This is not just like a side project. This is the focus of everything that they're doing, it seems. So they talk about providing minimal levels of education, especially for women. Again, that means, so providing education, we want to educate women, we want to get them out in the workforce and get rid of these traditional gender roles so that they reproduce less. It's not saying provide no education. It's saying provide education, just not, don't get to the extreme where they're getting too smart. Reducing infant mortality. Again, that sounds really good, right? Why would they want to reduce infant mortality if they're concerned about a growing population? They would want to increase it. Well, because when families, back in the day, before medicine showed an increase in value, the infant mortality rate was a lot higher, and it still is in certain countries. Well, when you have a situation where the infant mortality rate is high, you have people reproducing more and more. They just have more babies to provide that insurance, because part of the motivation for reproduction is to ensure future security. So it's not because they want babies to live, because they're simultaneously condoning family planning, which is, get as much, facilitate as many abortions as you can. So again, read between the lines. Expanding wage employment, especially for women, developing alternatives to children as a source of old age security, and education of the new generations on desirability of small families. So we have that education going on. They say, whenever they say education, what they mean is propagandizing them. We need to indoctrinate the children. And you do see this. They've been successful. You see this kind of tone of hostility towards people that have more than like 4 kids in their family. People saying like, God, keep it in your pants. And it's not generally, I don't think most people give a crap, but um, if you had to take the social temperature of that situation, you would see that people look upon larger families less favorably. So the indoctrination is real. We must take care that our activities should not give the appearance to the LDCs of an industrialized country policy directed against the LDCs, because that's what it is. So how can we make it not look that way? To help assure others of our intentions, we should indicate our emphasis on the right of individuals and couples to determine freely and responsibly the number and spacing of their children. So we need to make sure that we're looking good by expressing our desire for their right to freedom, but at the same time, we're going to indoctrinate them away from that ideology. We recommend increased emphasis on mass media to basically to control people's minds and how they look at having families, having children. Even stronger measures are required, and some fundamental, very difficult moral issues need to be addressed. Very difficult moral issues when it comes to depopulation. You don't say. These include, for example, our own consumption patterns, mandatory programs. So, tyranny is what that is, mandatory programs. Tight control of food resources. What is tight control of food resources? Well, we know from probably pre-Machiavellian times that he who controls the food controls the people. Tight control of food resources means we control who starves to death. With the beginnings of the Industrial Revolution and of modern medicine and sanitation over 200 years ago, population growth began to accelerate. So if that's the problem, advances in modern medicine, then what do we need to do to take care of that? Well, we need to infiltrate the medical industry, the pharmaceutical industry, get into medicine, make sure that we control that, because that has led to rampant growth rates, population growth rates, that we need to again gain control of so that we can inhibit them. Famine, pestilence, war, or birth control will stop population growth far short of this figure. Oh, the figure is 103 billion. That's their projection. If we don't do something about this, by the time the year 2000 rolls around, we're going to have 103 billion people. That's pretty crazy. It says, even the most extreme pronatalists do not argue that the earth could or should support 103 billion. Pronatalists. People who advocate for babies. Even those extremist pronatalists don't think that there should be that many people. All right, we got some graphs here that we don't really want to go into because we can just explain that. The annual rate of growth in Asian communist LDCs is expected to average 1.6% and subsequently to decline to an average of 1.2% between 1985 and 2000. The growth rate of LDCs with market economies, on the other hand, remains practically the same at 2.7. All right, so we see a really big problem here. Market economies, the growth rate is not decreasing. Asian communist LDCs, the growth rate is decreasing. So a good push for communism. Moreover, short of draconian measures, there is no possibility that any LDC can stabilize in population at less than double its present size. So we are advocating for draconian measures. Climatic changes are poorly understood, but a persistent atmospheric cooling trend since 1940 has been established. Holy crap. This is when there was an ice age coming to wipe us all off the face of the earth. Now, if this ice age comes, we could be experiencing significant famines. We're not going to be able to feed people, so we have to get rid of people so that we can feed the people that we do have. Of course, the ice age never came. Just like in 12 years, the world is not going to end because of global warming, as they're saying. They were wrong then, they're wrong now. usually when you hear your television telling you that there is a global threat and it's invisible, other than the fact that people who they say, the scientists say this is how it is. Oop, it's the scientists. Gotta trust scientists. These scientists are selectively presented on the television. There are a number of scientists that say that we're going through a slight warming trend, nothing to be alarmed about, and really the whole global warming alarmism is a government power grab. Really doesn't take much to see that, but a lot of people don't understand it. So yeah, it's really easy. You just say, you give these scientists a voice and you silence those ones, and then you can say, look, it's just science. It's just science. The world's going to end in 12 years. I'll put some money down on that. I would like to put some money down on that. The world is not going to burn up in 12 years. Anyway, a repetition under these conditions of 1972 weather patterns would result in large-scale famine of a kind not experienced for several decades, a kind of world thought had been permanently banished. Oh, a kind the world thought had been permanently banished. But it isn't. It's still there. We still have a looming threat. They have to keep these global threats alive and well. Otherwise, how are you going to persuade people to accept these really, like they said in their own terminology, these draconian measures? Nobody's going to accept it unless everyone's welfare is at stake. Kind of like what we're seeing right now with this pandemic. They would improve the possibilities for long-term development and integration into a peaceful world order. There's that terminology again, talking about a world order. The new world order that they're going for and how they're going to achieve it. It relies heavily on depopulation strategies. Here they talk about child quality versus quantity. There are certain biologic adverse effects suffered by high birth order children, such as higher mortality and limited brain growth due to higher incidence of malnutrition. We need to increase child quality, kind of like how the Spartans did it. Give birth to a child that's not 100% in peak physical condition, or has some kind of, maybe they're born with their fingers fused together, or they've got an extra toe. Throw them in a ditch and let them die. They're not genetically pure. We got to focus on that child quality, not quantity. The present 75 million or so, unless slowed by famine, disease, or massive birth control, will double in 23 years and exceed 170 million by 2000. Oh, so that's the figure, 170 million by 2000. Oh, that's just in Bangladesh. I was going to say that's quite a discrepancy from the 103 billion. Bangladesh is a case study of the effects of a few resources and burgeoning population, not only on national and regional stability, but also on the future world order. Oops. The World Population Plan of Action, despite its wordiness and often hesitant tone, contains all the necessary provisions for effective population growth programs at national and international levels. It lacks only plain statements of quantitative goals with timeframes for their accomplishment. I thought the same thing reading that, and that's when it occurred to me, well, that's not a classified document. That never had been. So they had to be more careful with their terminology. So I guess myself and Kissinger or his underlings had thought the same thing. They were tiptoeing around what they really need to get to the bottom of. Here it says, thus at this point we cannot know with certainty when world population can feasibly be stabilized, nor can we state with assurance the limits of the world's ecological carrying capability. So they admit right there they don't actually know that we have a population problem. We might be okay. The world could sustain billions and billions and billions of people. We don't know. We're just going to assume it can't. In these sensitive relationships, however, it's important in style as well as substance to avoid the appearance of coercion. We're going to coerce people, but let's not make it look that way. Part of this is concentrating on the education and indoctrination of the rising generation of children regarding the desirability of smaller family size. I still think Dr. Seuss had a role in this. Concentrating on the education and indoctrination of the rising generation. Or these were just poets. They're very poetic eugenicists. It is vital that the effort to develop and strengthen a commitment on the part of the LDC leaders not be seen by them as an industrialized country policy to keep their strength down or to reserve resources for use by the rich countries. It's important that they don't see it the way it really is, otherwise they're going to say no. Beyond seeking to reach and influence national leaders, improved worldwide support for population-related efforts should be sought through increased emphasis on mass media and other population education motivation programs. There's some more of that Dr. Seuss crap. And other population education motivation programs by the UN, USIA, and USAID. So indoctrinate. Moreover, with assistance from AID, a number of private family planning organizations, for example, Pathfinder Fund, International Planned Parenthood Foundation, Population Council, have significantly expanded their worldwide population programs. The desire for large families diminishes as income rises. Similarly, there have been some controversial but remarkably successful experiments in India in which financial incentives, along with other motivational devices, were used to get large numbers of men to accept vasectomies. That's one way to do it. Just pay people to get vasectomies. In addition, providing selected health care for both mothers and their children can enhance the acceptability of family planning. So if you just present it like this is health care for mothers and children, that's a good spin on terminology to make abortion sound more palatable. Because I would wager that back then it was a little more controversial. I mean, it's controversial now, but I don't think it gained a lot of acceptability. So what they're saying is we need to dress up the terminology. Let's phrase it differently so that it sounds more acceptable. So you refer to it as an abortion or an extraction or a tissue extraction or something like that. Let's see, concentration on education and indoctrination of the rising generation. Holy crap, it's getting worse. Of children regarding the desirability of smaller family size. So right there, in their own words, we need to indoctrinate kids. We need to impose informal educational programs. What's an informal educational program? That would be indoctrination. That's like when you flip on Netflix and you can't select anything that you're not getting preached at and indoctrinated by some kind of a social justice message. That would be informal education, otherwise known as propaganda. They're proselytizing you. Family planning in the health context shows a concern for the well-being of the family. There you go. So let's put it in a health context. Family planning. It'll sound better. Family planning, too. They're not even calling it abortion because even that's a bit much. So we're just going to dress this up in more palatable terminology. People will accept it more. The U.S. contribution to development programs and health programs has steadily shrunk, whereas funding for the population programs has steadily increased. So you see, this is a big deal. It doesn't make the headlines so much, but a crap ton of money goes into depopulation. Here they finally do reference abortion and say it, rather than calling it family planning. No country has reduced its population growth without resorting to abortion. So that really takes, you can off a lot of people through abortion. So that's their primary vehicle. AID's work suggests that radio, posters, printed material, and various types of personal contacts by health family planning workers tend to be more cost-effective than television, except in those areas generally urban, where a TV system is already in place which reaches more than just the middle and upper class. There is great scope for use of mass media, particularly in the initial stages of making people aware of the benefits of family planning and of services available. So this was in a time where not everybody had a television, and that's why they're saying radio, posters, printed material is more effective, I would wager. They're saying right here that actually, TVs are really just in middle and upper classes. That's not the case anymore. Probably the biggest resource now for them is the television. But doesn't this sound like it was written by Hermann Göring of the Third Reich? Radio, posters, printed material, that's how we're going to indoctrinate people. This is very clearly relying on a plan to propagandize people to go with their ultimate aim, which is to depopulate. Now, the reason all that was necessary is so that we can get into these other documents, these drills that they're running, the SPARS drill, the Crimson Contagion drill, these things that have emerged, some of them right before COVID was rolled out, and have some startling parallels, right down to tweets that have come out from CDC. I don't know. I could go on about it, but I'm trying to not have these super long videos, A, because they take forever to upload, and B, because it's better to just take it piece by piece. I'm not going to put what they are in the description because I'm trying to avoid YouTube algorithms. The censorship, as evidenced by that Johns Hopkins report that we're going to go through, is crazy, and the sophistication is being enhanced. The algorithms are being enhanced, and they're going to be able to catch things that go against the state-sanctioned narratives that we're supposed to swallow. And I don't want to put anything in there that they're going to catch and kick out based on that. They're probably going to anyway. Another thing that I have working in my favor is that I'll probably get a total of 5 views on each of these. But whatever, if it convinces one person, it's good enough for me. So that, the lack of popularity is a strength, and the not saying what it really is, at least in the description. However, because their algorithms are becoming increasingly sophisticated, I think that obviously they're going to have speech recognition. They're going to be able to say or determine what I'm saying, and choose to probably kick me off of YouTube based on that, unfortunately. And there's no way I can actually go over this stuff without actually saying it, without actually saying COVID and things like that are going to be buzzwords for them to start paying attention to. I guess I could start spelling everything out. Seems a little cumbersome though. Probably won't do that. So that's it. That's the NSSM 200 Kissinger report. I think I will follow that up with perhaps the SPARS pandemic exercise. Again, really a really telling document. So that'll be an interesting one. Probably do that next. Otherwise, done for today. That's all for now.